Here's our next video in the series on ACL rehabilitation, following an athlete from surgery all the way back onto the field. It is now week 16 of Maddie's recovery, and this is the final week of phase 3. In this phase, we've worked on running, sprinting, pivoting, cutting, jumping, and progressing functional activities to prepare her to go back onto the field. Now, the other thing that we've been working on is more plyometrics and working on absorbing impact forces. Box jumps is shown here as one of the exercises that we do, concentrating on the landing and using her quads to absorb the stress of hitting the ground. We also added as a fitness component the 300-yard shuttle. Cones are placed 25 yards apart, and the athlete runs back and forth 6 laps for a total of 300 yards. They're timed, they rest for 5 minutes, and then they do it again. The difference between the first trial and the second trial gives us an idea of their fitness level and their ability to recover after this type of activity. Now, this is a standardized test that you can use, and there are different standards for both male and female athletes. With our soccer players, we like them to do the 300 in under 60 seconds for the girls. Here you see Maddie pulling the sled to work on her acceleration. She jogs, accelerates for 5 yards, and then decelerates. And here we have her using the Viper cord to backpedal and then use it to slingshot her forward to work on those few accelerating steps. You can see it's difficult for me to hold the camera and be an anchor for the slingshot at the same time. From a strengthening component, we have her do large back pedal strides to work on the glutes and hamstrings, some single arm rows like we've done previously with the knee bent to work on co-contraction of the quads, hamstrings, and glutes, as well as doing some upper body exercises such as the shoulder three-ways, which is shown here. And I put her on the TheraBall to do these, so as she has movement, this will bring in her core muscles, which are always important to try to incorporate into an exercise. Now, in regards to the functional activities, the main thing that we added this week was to have Maddie start hitting some long balls and do some shooting. Originally, we would have her hit the ball with her left foot, so her right leg was her plant leg. And then as she got more comfortable, we'd have her left leg as her plant leg so she could work both sides. We'd start with 8 to 10 yard shots, and then as we see here, we move back to more to 15 to 17 yard shots, just working on getting the volume in and getting used to her striking through the ball. Now, as we look forward to phase 4 in the next 4 weeks, we want to really focus on maintaining the strength base, work on the sprinting technique and her speed, and really work on sport-specific skills on the field before she returns to a controlled practice.